Imagine if somebody designed a family home, but completely ignored the needs and the realities and the preferences of the family that would occupy that dwelling. A cliff-style location with stark beauty, just right for a house full of toddlers. Beautiful, wide-open, loft-style bedrooms with ladders and circular staircases for grandma and grandpa. A wonderful pergola, but no place to put cars, garbage cans, bikes, or toboggans. It would be disaster. There was a time when mental health services for children and youth and their families were a bit like that. It was all about the expertise of the practitioner as expert, and the child as a recipient of service. It was pretty much a closed loop. But we were missing the boat because we didn't recognize the untapped potential of family involvement and engagement. We've come a very long way. Today, we see very clearly what families bring to the design of practice for children and youth. Contemporary practice embraces the notion of family engagement as a fundamental value. Family engagement begins with the individual child or young person, and that young person is still the primary focus of the treatment. However, when the family is a partner in the process, the family, the circle of care and support, becomes an essential part of the experience. It begins with adopting a family-centered approach to practice and creating a family-centered environment, culture, and policy framework that says, this is the way for us to harness the positive energy of our families and, in so doing, get the best outcomes. It then moves outward to family involvement, in which family members support and participate in their child or youth's mental health care, work hard to create supportive home environments, and also engage with the broader community, schools, recreational organizations, and the like, to provide resources to help the young person and the community mental health agency succeed. The third level, family engagement, is about motivating and empowering families to recognize their own needs, strengths, and resources, and to take an active role in changing things for the better, working in the process of positive change. It's about listening to what families think and bringing their voice into the treatment plan. It's about engaging them in real communication as you both identify issues, develop strategies, find the best path. Finally, it becomes a fundamental part of how the organization thinks and works as we respond to treatment needs based on family choice and collaborative assessment. In this way, the strengths, capabilities, resiliency, and skills of families are drawn upon, celebrated, supported, and emphasized. At a practical level, when you embrace the concept that the whole family is the client and is the resource for change, it begins to make sense to facilitate the relationship in very simple but very practical and important ways. Where do you want to meet? When do you want to meet? How can we get you there? How will we stay in touch between appointments? How about childcare and other practical realities? These tactical discussions grow out of respect for the unique situation of each family, and each family is as different as can be. And when family engagement becomes the way of working, the impact is powerful. Families feel truly supported in their caregiver role and are able to work with the practitioner on the impact mental health issues can have on day-to-day family life. Families feel engaged if they see a fit between the intervention and real life, the reality of their day-to-day lives, cultures, religions, and more. Children and youth who pick up so much of what is going on around them begin to feel that there is a team being built that is centered on their needs, their care. Involved families become conscious of, interested in, and then committed to involvement at the service or program or policy level, as volunteers at a variety of levels that can bring unique perspective and palpable energy to the leadership of the organization. At the end of the day, it's about positive mental health outcomes for children and youth, about significant improvement in accountability, quality service, and support that reverberates across entire communities. It's about unique, customized, and highly effective solutions, not cookie-cutter approaches. The Ontario Centre of Excellence for Child and Youth Mental Health has both resources and direct expertise that can help your practice or your organization embrace family engagement. don't hesitate to call us or contact us through these coordinates.